So I'm Iman HOSNI from Leeds in the UK, and I'm presenting this sustainability in healthcare and orthodontics. Where do we start? So a little bit about me. I graduated from Newcastle University in 2017. I did my postgraduate training for a couple of years in different dental services and oral surgery and community. And I'm a member of the Royal College of Surgeons, and I'm currently in practice in Leeds. So a little bit about Leeds. I don't know how many of you have been visited, but it's a lovely city in the middle of the UK. It's famous for the Yorkshire Dales and tea and cake and lovely scenery. So I recommend a visit. So overview of my presentation. So I'm going to look a little bit about sustainability and what it actually is, what it means to be sustainable. And then how that links to climate change, how healthcare links to climate change, why it's so important, and how we can be sustainable in oral healthcare, and then a little bit about the research. Our research is ongoing at the minute, so I'll give you a bit of background on what we've done so far. So sustainability is sustainable development, well, how the UN World Commission on Environment and Development describe it is meeting the needs of the present without compromising the ability of future generations to meet their own needs. So essentially, to be able to maintain something at a certain rate without harm or destruction to the environment or to people. So in practical terms, sustainable practice should use renewable resources that can't be fully depleted and to be distributed using as little energy as possible, minimizing waste, and to be as environmentally conscious as possible. Socially sustainable practice also cares about the health and well-being and success of their employees and residents of the country. So in terms of climate change, and obviously it's a very big topic, it's very topical at the minute. I think there's a lot of global awareness, and we've seen in some of the presentations today, like sustainable shoes, and it is very important. It's something that we're all thinking about, the damages and the concerns for our future generations and our Earth. So we've had the Paris Agreement in 2015 and the 2021 United Nations Climate Change Conference, COP26 in Glasgow, where we had representatives from all over the world, looking at how we can all make enhanced commitments towards mitigating climate change. The outcome was the Glasgow Climate Pact recently, which committed to reducing the use of fossil fuels and coal. So just a few little statements about global warming. Obviously, we all know how important it is, but evidence is unequivocal and is believed to be recently due to human activity. The pollution that we've caused in 1 century is comparable to that that's been created over thousands of years previously. Sea level has risen over 4 centimeters, and the global carbon dioxide emissions are actually rising faster than what the IPCC, which is the Intergovernmental Panel on Climate Change, have predicted. So it's actually going worse than we imagined. So how does this link with healthcare? So the Lancet have said that the climate emergency is a health emergency. Climate change and healthcare are inextricably linked. The effects of climate change, as we know, have direct and indirect, immediate and long-lasting consequences on the health and well-being of our population. We've already seen increasing heat waves, more frequent storms and flooding, increased spread of infectious diseases, increased illness, mass migration of populations because of the environmental effects, and deaths. And without action, this is expected to increase progressively. So the healthcare sector contributes to the carbon footprint. In the UK, it's about 4% of England's carbon footprint. And these are all the areas that we can look at. So it's really important to strive for a healthcare system that is sustainable while still providing everything that we aim for, which is high quality, safe and effective care. And it's all of our responsibilities as professionals. I mean, I think we've seen that it is something that everyone's thinking about across different areas. But I think what we found with healthcare is we are moving towards it, but it's more, as global citizens, I think we recognise our responsibility, but we want that to transfer into our healthcare as well. So this leads me on to my specialty, so orthodontics. Orthodontics is a specialty of dentistry that treats misalignment of crooked and protruding teeth to correct problems with bite. It can be carried out in primary care, just a little background, primary care by specialists, or it can be referred to hospitals for more complicated cases that require consultant-led or multidisciplinary care. Whichever the setting, there is a high amount of single-use plastic that we use and a high amount of waste product, much like many specialties across healthcare and also across, not healthcare, other areas. So this is usually because it's the most economic and convenient way to treat patients. However, it's not the most sustainable, and it does create a large amount of waste. So from procurement of our instruments all the way to waste disposal, there are multiple steps where we can make a difference. And these are just some examples. These are plastic mirrors, which are disposable, which are a lot easier to use. And these are metal mirrors that you can sterilize and reuse. So that would obviously be a more sustainable way. And there's lots more examples of plastic paper bibs that we could be using instead of plastic, use of recycling the instruments, how we package instruments after they've been de-sterilized. There's just a lot of areas where we can look at how we can be more sustainable. So in oral health, so this is in the UK, it makes up 3% of the overall carbon footprint of the NHS. And so there's a good body of research at the minute looking at sustainability in dental care, and it was found that the greatest forms of carbon emissions actually were from patients traveling to appointments, staff commuting to work, and then you've got procurement, gas and electricity, waste disposal, nitrous oxide, which is used in inhalation sedation to treat anxious patients. So there was a guide that was produced called the Sustainability Dentistry Guide, and that was published by the Centre of Sustainable Healthcare, and it outlines areas that we can focus on to be more sustainable. So you can see, for example, looking at where we can avoid anesthetics, general anesthesia, for example, where you could have local anesthetic, looking at telephone appointments where you don't need to come in to gather some information first, recycling orthodontic appliances, the use of radiation. So there's lots of different areas where we can look at. So, and the aim is to still provide high quality patient care, which is both economically and environmentally sustainable. So our aim is we want to investigate the current knowledge, and we know there's a lot of research out there. There is these guidelines in place, but we want to know what are the current knowledge and attitudes of healthcare professionals towards sustainable dentistry. Do they think that it's achievable? Is it applicable to be able to put all of these into place, and to investigate any perceived barriers to practicing sustainable dentistry? So it will be a cross-sectional survey. We're going to conduct it as a pilot study. So we're looking at orthodontic clinicians at the minute, but we do hope to do a subsequent study looking at healthcare professionals as a whole. We can use it in different areas, and even in different countries. It would be quite useful to compare the situation. So we're going to carry out data collection by use of a questionnaire that will be distributed electronically to all orthodontic clinicians. And we're going to do this through the British Orthodontic Society to start with. The questions will be based on the current framework developed by the Centre of Sustainable Healthcare. So like the guide that was up previously, it's going to be looking at what clinicians have in place at the minute. Do they have recycling in place, for example? Do they have how are they limiting the amount of inhalation sedation that they do? Are they referring to local places rather than sending their patients much further when they could be seen closer? So these are all things that we're going to be looking at, and then we will be analysing the data to assess the applicability, and then once we've identified any barriers, look at the implementation and suggest appropriate recommendation for the way forward. So we're going to be using qualitative methods of analysis, where we're going to look at the answers that we get back, hopefully, and identify common themes within the survey response, and utilise these in exploring strategies to move forward. So in conclusion, global warming is the increase in the average temperature of the Earth's surface, which has been increasingly worsening in the past century. So due to these worsening effects, it's absolutely crucial that we take this, our global citizen responsibility that we are talking about, and actually implementing that in our healthcare practice on a daily basis. And it's responsibility of everyone on a, every individual working in healthcare, and making sure that they are engaging with sustainable practice. And so our research is just find out exactly where we are with that. We know everyone knows their responsibility. We want to just find out where we are, how people are practicing sustainable, what are the barriers if they aren't, and then how we can move forward to improve sustainable practice. Thank you.
Thank you very much for your presentation. I have just a few suggestions for you.
Yeah.
We started from the topic itself. If you look into the topic itself, which is talking about the sustainability in healthcare, and where do we start? It's overall, it's a very general, it's a very wide, it's a very large topic itself.
Yes.
But when we go to see, like you started your presentation from the climate change impact on the environment and coming out to the health system. So I just have a suggestion first for you to revise your topic, which should be, because your main aim is to identify the knowledge and the attitude of the health professional, especially specifically from the dentist department, isn't it? Dentistry. That's your key and specific area. So my suggestion is the topic should represent your specific research aim as well. So you need to describe, you need to specify your topic first itself, because your topic itself is a very open, it's a very wide, but rather than in a research study, we should have to be specific. That's the first thing. Second, my suggestion is that because you are going to conduct a survey study, isn't it? And that's a mixed method you are trying to do. You are conducting the research questionnaire quantitatively, and also you are going for interviews qualitatively, right?
Yeah.
So you are going for a mixed study.
Yes.
Am I correct? Because in your method, and secondly, and importantly, because you are going for the only dentistry professional, correct?
Yeah, initially we're going to be looking at our area, and then hopefully if we can gather more data, it is quite a big area, so we wanted to look at something quite specific first of all.
That's what I said, because your research cannot be a very, very wide. You have to be very specific where you're initially and specifically starting from the dentistry, where you have to wanted to know their attitudes toward the sustainability.
Yes.
So I just wanted to add, if with attitude, the human behavior is more important to understand, and we need to investigate the human behavior toward the sustainability rather than attitude. So I just suggest you see, meanwhile, when you are going to explore the attitude of the dentistry professional, you also need to see their attitude, their behavior toward the sustainability. So that's just my suggestion. If you add in your objective, one more objective, attitude and the behavior as well, because both has the two different meaning and two different things. Someone could be have a good attitude. Someone could be have a good attitude toward the sustainability, but we can see the opposite behavior.
That's really interesting. That's a very good point.
So that's my suggestion. You can add one more thing in your aims that could be behavior as well, and which is more important than the attitude.
That's true, because the behavior will affect, whether they actually carry it out or not.
Exactly, because
that might be one of the
behavior. Yes, the human behavior is more important towards the sustainability than just we have a theoretical attitude. Everyone is talking about theoretical attitude toward the sustainability and the climate change, but in the practically when it's come to the behavior, so because we are maybe very conventional kind of a human, so we are not being trained to change the things, to adopt the sustainability in our whatever department or whatever organization we are working.
That's true.
Or
I mean, it might be that when we carry out, when we're finding out, one of the barriers that we find is human behavior. So it'll be interesting. So you're saying you think it would be a good idea to actually have human behavior as an objective rather than discovering that that might be one of the barriers that that we find out from the study, from the research.
yes, that's true. Thank, that's true. Overall, very interesting. Thank you very
Well,
much for joining. Thank you very much joining us, and thanks for the presentation.
thank you.